Understand that there's been a tremendous amount of preparation made at USA Health as it relates to COVID-19. Walk us through what's going on.
Well, yes, there's been a lot of preparation here at USA Health over the last month or so. Probably the easiest way to look at it is to sort of put things into big buckets, and I would say those buckets would be number one, preparation, number two, testing, and number three, actually planning to provide the care and make provisions for the flow of patients through our healthcare system. So I'll just take each of those one at a time. On the preparation side, there are a lot of different things that had to be done and are still going on with regards to preparation. We have to, number one, protect our patients, and that involves changing visitation policies, following the Centers for Disease Control's guidelines for visitation policies for both our Children and Women's Hospital and our adult hospital. It involves screening of visitors and employees when they come in the hospital, making sure that our visitors aren't coming from different areas of the world or different areas of the country where the disease is highly prevalent and therefore putting our people and our patients at risk. It involves moving towards putting policies in place to ensure that the employees are all very aware of whether they might be infected with the disease or might be exposed to somebody infected with the disease, because again, the safety of our patients is at the highest priority. And it also involves moving towards checking temperatures on patients that come into the hospital and obtaining the equipment necessary. Believe it or not, that's actually a pretty difficult thing, to be able to rapidly check the temperature of several hundred people when they come in the hospital 3 to 4 times a day in waves. So that's some of what we're doing on the protection side. Also under preparation involves getting the physicians, the nurses, and all the other folks that work at the hospital to be on the same page. When the patients start coming in, we've got to decide where we're going to put patients that have coronavirus. What part of the hospital are we going to put them in? Will we be able to isolate them to one area of the hospital? And will we be able to cohort them as necessary? Which doctors will be taking care of them? Which teams of nurses will be taking care of them? We've got to go back and we've got to make decisions about identifying the doctors that will be taking care of them, and coming up with plans for those doctors and other providers to be able to space themselves out for the long haul, because we could be in this for weeks to months. And so we've got to design new ways of scheduling our physicians and our other providers to be able to, number one, keep them healthy, number two, keep them rested, and number three, keep them available for our patients. So that's been going on within the different specialties that would all be taking care of these patients. What will we do about elective surgery? Well, when we use the term elective surgery, we can really think in terms of essential and non-essential elective surgery. There's always emergency and urgent surgery. Those are different, trauma, gunshot wounds, and those sorts of things. But in the realm of what most people would call elective surgery, there are some elective cases and patients that need elective surgery that really can't wait. And those cases, we need to try to get those done when we can, and in the appropriate time span. For example, cancer cases. So we've categorized our elective surgery into essential and non-essential surgery. We're doing the best we can to move through with the essential surgery, and at the same time still have capacity for emergency and urgent operations. And we have now taken the step of canceling our elective non-essential surgery, cosmetic surgery and those sorts of things, because those can wait until the time is right in terms of both patient safety and provider safety to get those done at a later time. That frees up capacity and people in the operating room to allow those nurses and physicians that would otherwise be doing those operations to help us in other areas. So that sort of falls into the preparation bucket in terms of who's going to be taking care of these patients. Other things that we've been doing involve, as everybody knows, and you'll see this in the lay press, as everybody knows, trying to inventory and preserve our personal protective equipment, or PPE, in the long term. And preserving personal protective equipment means using personal protective equipment or using PPE when it's appropriate and not using it when it's not appropriate. People will, for lots of different reasons, feel like they ought to be suited up maximally for every patient encounter, but that's really not necessary, nor is it in the spirit of preserving this very precious and very scarce resource for the long haul. So we've come up with policies and guidelines for when it's appropriate to use different levels of PPE. The N95 mask you've heard a lot about. There are limited situations where N95 masks should be used, and there are other areas where you can get away, where you can safely use masks other than N95 masks and eye protection other than some of the more scarce types of eye protective devices that are available. So we've developed guidelines around PPE policy that we've circulated widely through our healthcare system to work along this regard. Another important area of preparation involves the physical plant. In other words, where will we put these patients infected with coronavirus when they arrive? And how do we ensure that we have all the physical and operational tools that are necessary to be able to provide them with the care they need? This could involve straightforward, typical medical care. It could involve intensive care level capabilities, and it could even involve emergency surgery on these patients. So we've made preparations across both of the hospitals in our system for all of these eventualities. We've actually converted a wing of the fourth floor of our hospital here into an ICU. We actually did that in less than a week. We stood up an ICU in less than a week. And we've also designated the other beds on that floor as facilities that we'll use to sort of cohort or keep our patients that are suspected of or have coronavirus in one place. That's for their own protection and the protection of the other patients in the hospital. In an extreme emergency, we've designated actually an entire geographic wing of the university hospital as an area where we can almost create a hospital within a hospital to care for these patients and provide everything from routine care to intensive care to emergency surgery for them in a separate wing of the hospital as well. Within our children and women's hospital, we've designated a wing of that hospital as another area where we can house up to 15 patients with coronavirus at both the routine level of care and at the intensive care unit level of care also. Another one of those major buckets that I described was the actual treatment of the patients, and several things have been done along those lines. If you call your physician's office, you have two options if they feel like you need to be seen. One would be to offer you the opportunity to come in and see them if they feel like medically you need to be seen on an urgent basis. And the other would be to have what we would call a virtual visit. A virtual visit could entail either a conversation on the phone with your physician or a visit over the internet with some visuals involved. We've set up systems across all the outpatient sites within our healthcare system to be able to have these visits in this fashion. And some of our departments have actually gone to 100% now virtual visits. The third big bucket that I described earlier revolves around testing. Testing for patients to see if they have coronavirus or if they're not infected. This is a very complex topic, and we've done a lot of different things in several different areas on the inpatient side, which means in the hospital, and on the outpatient side, which means either in the doctor's office or even with drive-through testing. The first decision that has to be made is whether a patient requires and meets the criteria for testing for coronavirus or not. This is important because if we don't have the personal protective equipment available, and none of the healthcare systems in the country really have the personal protective equipment available right now to be able to test everybody who wants a test. While we'd love to be able to do it, it's simply not a reality right now. So we're following the Center for Disease Control's recommended criteria for testing patients to get the highest possible yield. In other words, test as many patients as you possibly can that are at the highest risk for testing positive for coronavirus. These criteria involve things such as temperature, having a cough, having the sniffles, having sneezes, or having been exposed to somebody that either has or is at very high risk for coronavirus for a prolonged period of time. If you meet the appropriate criteria, then the next step is making the test available to the patient. That can be done again in three different settings broadly. One setting would be drive-through testing. So if a patient has mild symptoms, meets the criteria for testing, and does not need to be seen by a physician or admitted to the hospital, then drive-through testing is appropriate for a number of different reasons. Number one, it keeps the patients away from the more complex healthcare systems and allows those more complex structures within the healthcare system the opportunity to focus on the patients that are sick. Number two, it protects the patients from being exposed to lots of different things that may occur within a complicated healthcare structure or setting like a hospital. And number three, it's convenient for the patients. So we've set up an ambulatory or drive-through testing site for the patients within our healthcare system that meet the criteria for testing but don't need to be seen in a doctor's office or a hospital. And this site has trained personnel performing the tests through the appropriate and approved companies that are running these tests. And if a patient meets the criteria for drive-through testing, the call center at USA Health will direct them to the site, and they will receive instructions once they get there as to how to undergo the test. Probably takes somewhere around 15 to 20 minutes per patient to go through all the process of getting tested. The second area of testing would be within the physician's offices. Now, our physician's offices are set up in such a way to protect the patients and the workers when they come in. Patients that have respiratory problems or might be at risk will be given a mask as soon as they arrive, and they will be moved to an area of the office where they can be, number one, screened, number two, registered, and number three, tested if appropriate for coronavirus. So the same procedure for testing occurs in the physician's office that would occur at the drive-through site. It's just done with the patient in the office. Finally, the third area of testing would be within the hospital itself. And again, we're using the companies that are providing tests and making those tests available for us. We're following the same procedure again in the hospital, and we've built the structures and the processes in place within our electronic medical record for the physicians to be able to order the tests and for those tests to be performed in the hospital setting. One thing that's important for all of us to remember is that because the tests are of limited availability locally, regionally, and nationally, it still requires a physician or a provider's order to be able to undergo the test.
What's your best advice for people out in the general public? How can they take care of themselves?
My best advice would echo what you hear on TV and what you would read if you were to look at the Center for Disease Control or the Alabama Department of Public Health's website, and that is social distance when appropriate, use hand cleaner frequently before and after you enter public places, before you get in your car, before you go in your home, cover your cough or sneeze, and avoid large crowds whenever possible.
If a person's having symptoms, what should they do?
Any patient or member of the public that might be concerned that they have coronavirus should call their physician as the first act. They will receive advice from their physician after being evaluated through telephone screening as to what the next step should be, whether that would be to come into the physician's office to be evaluated or to be directed to a drive-through testing site. Could very well be that neither is indicated, and that would be the best of both worlds. Do not go to the emergency department.